These particular companies I speak of, for instance, are those that are involved in the distribution of drugs, the logistics companies. Now, I paid a visit to the Papua New Guinea General Hospital not too long ago in one of my routine inspections, and I spoke to the doctors there, and they told me that the issue of shortage of drugs is primarily due to these logistics companies not delivering these drugs on time or to the areas where they're supposed to deliver them to. And I was surprised to find that now this particular company, and I won't name this particular company, operating in Oro Province, does not have a warehouse, does not have the wherewithal, and it gets these drugs from the area medical store and then keeps it under its house and distributes it at will and whim, making it very difficult for the PHA. The PHA has to actually fund the distribution of these drugs again, when this company is already paid to do so. This company was characters and creatures that are operating in there, that are threatening the lives of our people, need to be dealt with. So, Minister, can you explain to us if you have put together such a team, and if not, why not, and when will you do this? And can those recommendations in that PAC inquiry of 2019 be implemented?
The Honourable Governor for Oro.
Thank you. Speaker, the question I wish to ask, or the series of questions, is to the Minister for Health. And they are in regards to the issue of the Public Accounts Committee inquiry into health that was held in 2019. This inquiry was conducted for the purposes of investigating widespread corruption within the health department. You know, corruption that inevitably led to the loss of lives of many Papua New Guineans. And this inquiry found significant corruption whereby various individuals and organizations were said to have been involved. Now, to date, we need to understand exactly where this inquiry has taken us. And I raise these questions because it's come to my attention that some of these companies are still operating and still very much involved with the health department. These particular companies I speak of, for instance, are those that are involved in the distribution of drugs, the logistics companies. Now, I paid a visit to the Papua New Guinea General Hospital not too long ago in one of my routine inspections, and I spoke to the doctors there, and they told me that the issue of shortage of drugs is primarily due to these logistics companies not delivering these drugs on time or to the areas where they're supposed to deliver them to. And I was surprised to find that the companies named are the same companies that were revealed or exposed in that inquiry. So from 2019 till now, these companies are still very much operating with impunity. Now, this particular company, and I won't name this particular company, operating in Oro Province, does not have a warehouse, does not have the wherewithal, and it gets these drugs from the area medical store and then keeps it under its house and distributes it at will and whim, making it very difficult for the PHA. The PHA has to actually fund the distribution of these drugs again, when this company is already paid to do so. The company was highlighted in that inquiry as being one of the bad actors that should have been immediately, that their contract should have been terminated. But they're still there, engaged and operating. So my questions are these. Can the health minister advise us as to what he is doing with this inquiry report? Does he have a team that's going through that report to ensure that the recommendations are implemented? Now, I know that his previous ministers had made an attempt to do that, but the beast within that organization seems to have stymied the efforts. They couldn't do it. That's the reality. Now, Minister, you're doing a magnificent job, and I must commend you for this. But these companies, these insidious characters and creatures that are operating in there, that are threatening the lives of our people, need to be dealt with. So, Minister, can you explain to us if you have put together such a team, and if not, why not, and when will you do this? And can those recommendations in that PAC inquiry of 2019 be implemented once and for all? Thank you.
The Honourable Minister for Health.
Thank you. The Deputy Speaker, thank you very much for this important question raised by the Governor for Oro. First, the Department of Health is fully aware of the 15 recommendations that came out from a public accounts inquiry in 2019 We have established a task force in the department. That's what I'm aware of at the moment, and I will give a full report on what we have done and where we are today with regard to implementation of the 15 recommendations from PAC. I'll give a report on Friday this week, so to this Parliament, if the Speaker can allow me to give a report this week. With regard to the person supplying medical supplies out of Oro, we will look into that, and I'll get a full information on that as well, and to establish this particular person or particular business entity and find out what is actually happening. So I'll report back to Parliament. That's the answers to this particular question raised by the Governor of Oro. Just to make some clarification on, just use this opportunity to say today on this floor of Parliament, in the past we have a push system, now we have pull system. A push system is usually the past where we have, as you all know, we have a 100% health center kits that were being supplied right across the country, supported by the Government of Australia especially. When we are waiting for the normal procurement of the department, low-margin supplies come through, there's a push system that just push. There's a standard list of medical supplies that they would just push throughout the health system in the country in the past. So what has happened was you got plenty of storage space. Now many of those were actually expired. Now plenty only used long health center and at post level, because most of those are supposed to be used in category 8 drugs were supposed to be used only by doctors, hospitals, now health facilities, along like urban clinics where doctors stop. So we have found out that there was a lot of wastage, so we installed a pull system. At the moment, we embark on this only a pull system. Pull system is where requiring more health facilities, must maintain more truck control or order blow all the time, every month. Every month, somebody at the health center must be doing maintaining a stock control of where they are in terms of their respective orders or drugs. Now, put this supply go along provincial medical store. All of the province play with today, you got provincial medical stores right across the country. Now also ordering all medical supply belong all area medical stores. We have 5 area medical stores in the country where all provincial transit medical store is a order blow. And then all health facilities, centers, health centers, districts, they get their supplies from the provincial transit medical stores. So what we have, Padili, we have Wewak, Boram, Wamlas Tablo Wewak, Wamlas Tablo Lay, that's 3, Wamlas Tablo again, and Wamlas Tablo Kokopo. That's 5 of these area medical stores in the country. And then we have, right across our provinces, we also have provincial transit medical stores. What is happening is there should be a communication between what is at the provincial transit stores, and when something is area medical stores. So there must be communication. As referring to the question raised by the good opposition leader yesterday, we have an M supply system that monitors what we have at the moment. We have a on-time record of what we have today in all the area medical stores in the country. Now we got long provincial transit stores. Now we got all supply to. We know the stock level of each of the pharmacies at the respective hospitals. So the hospital too must place the order blame all provincial transit stores too. So there must be somebody there monitoring the stock control every month, and then placing the orders every month. That's a pull system, depending on the requirement and the demand. So what has happened is we have found out through the system that there is nobody. Most of the cases, online is tablo, making sure they'll track control, all not make work blow too. So for example, in one of the, you find out from example, taking a point, in example of Alatao, area medical store, there was some indicating, showing on our M supply system that there's about 68% of the health facilities, health stocks there, they were actually nearing expiring dates. So all members of Parliament, next time when your health facility is saying that all no got margin tablo up, you try to go and ask him along provincial transit stores tablo way, area medical stores tablo way, and you try to go and look him also all your stacks of medical stores that's supposed to be going to respective areas, they are still in there. So you assist to look sim car blue na assist lo support logistics na salim go lab blue. So I'm just getting out of it.
We have a point of order. Governor for
Mr. Speaker, this point of order is a wonderful opportunity for me to raise another issue with the good minister. That the transit warehouse that he is talking about, well, the one built in Oro was built through a very corrupt process. We highlighted it to the department, and it's still there, hasn't been completed, hasn't been built yet. So we don't have a transit warehouse. because the National Department of Health, some years ago when I raised this with them, had failed to attend to that building that they had built through a very corrupt process. That building is still there, unoccupied, unused, and it's not fit for the purpose that it was built. So, good Minister, please make an undertaking that you will also look at this particular building in your list of things that you're going to do from these questions I have asked. Thank you.
Honorable Minister, you continue on with your reply.
Thank you again. The Deputy Speaker and Dr. Law, they respond to the Governor of Oro. I will be going to Oro next week to see the warehouse myself and see the particular area. And so we looking at could report the governors. Look, Savelo, health facility, also on him. There's a warehouse here. I'm being one process now. Only make him. So by me, Oro. I know that you have done a lot of good work there, operating theater that needs to be commissioned after some years, and extra facilities coming back on. I'll come to Oro next week and visit that place. But I'll give a full report on the questions that this asked regarding the PhD recommendations this week Friday. Thank you, Deputy Speaker.